For the first time since we started the Nation Leadership Forum, we are going virtual. These are not normal times. The world is dealing with a health emergency unlike anything we have seen in a century. We are dealing with a disease that is no respecter to age, religion, gender, nationality, or social status. Let me state the obvious. Coronavirus has changed our way of life. Despite the many disruptions, we at the Nation Media Group hope that you and your family are safe and well. Our hearts go out to those who have lost loved ones to this virus and wish a quick recovery to those who are sick. We also do recognize the bravery and courage of our frontline soldiers battling this disease to save lives. That is our doctors and nurses. Thank you so much for joining us tonight from around the country and those following this series of the Nation Leadership Forum together with our partners. You can follow this conversation on our social media platforms with the hashtag NMG Leadership Forum. And so tonight we will look at how coronavirus has changed our lives. Now, joining us from different locations in the country, in our virtual panel, we have the Cabinet Secretary Trade and Industrialization, Betty Maina, who will help shape this discussion through the lens of government. From the United Nations, we have Siddharth Chatterjee, currently the resident coordinator, to help expand the development partners' perspective on coronavirus. A critical component in the fight against this disease is, of course, the emergency response. And Dr. Asha Mohammed, the Secretary General, Kenya Red Cross, joins us from our office and will help paint the picture of what is happening from a humanitarian standpoint. Jeremy Awori, the Managing Director, Absa Bank, will help us understand the impact of this virus on the private sector. And because this is in turn is affecting many homes, Dr. Stanley Mukolwe from Raising Future Parents will guide us through the impact of the virus on life and families and what kind of support is needed. So, ladies and gentlemen, welcome to this broadcast and to our panelists as well. And I will start off by just asking this very simple question. How has your life changed? And I'll throw this question to the entire panel, but I want us to start off with the CS Trade and Industrialization, Betty Maina. How has your life changed with this coronavirus pandemic?
Thank you very much. And thank you for putting this together. I think everybody's life has changed as a result of coronavirus. I definitely find myself, first, I think the issues around being careful in interactions with people, and especially the issues of social distance. It has become a very strange thing, but we no longer shake hands and you don't go close to people. So that's one. So no hugs, no shake hands, and no close proximity. I think the second thing that has happened is as a result of the measures, a lot of public places have closed. So we find that we're spending a lot more time with family, and especially in the context of the curfew. So that's actually a very pleasant thing, being able to spend more time at home. The third thing is being able to do this. We would have been in the studio or waiting to start for a long time in a joint location, but now we're able to do things more online. So it actually becomes a lot more efficient and much more pleasant.
Well, very many thanks, Betty. Indeed, life has changed. And I want to throw this also to the resident coordinator of United Nations. And allow me, sir, to call you Sid. How has coronavirus pandemic changed your way of life and your way of doing things?
Family, it has been a dramatic shift of life. First and foremost, we've started to work and telecommute in our work. But at the same time, we have a duty of responsibility to the most vulnerable in supporting the government to respond to this particular crisis. Don't forget that Kenya is also coming out from a protracted drought, followed by floods, followed by a locust invasion, which has kept the United Nations family extremely busy over the last 2-3 years. But now with the arrival of the COVID pandemic, it has really, put us on tenterhooks. But at the same time, while we are telecommuting, we have close to about 80 staff embedded with the government of Kenya to provide the necessary capacity and support to be able to respond to this crisis. It is perhaps an acid test of multilateralism, and I think that is what has changed quite substantially at this present moment.
Well, Sid, I realize both you and Betty are you're looking at the entire perspective of what this pandemic has done to the entire country and obviously globally. But just at a personal level, I will want to bring in the Secretary General of the Kenya Red Cross, Dr. Asha Mohammed. How has this at a personal level impacted your life?
Good evening, and thank you for that question. I just want to start by saying, yes, I'm a social animal, so for me, this has really changed my life, both at the workplace and at home. I normally like to interact very closely with colleagues and also at home with the family. And so this has been very difficult in order to be able to, of course, keep the physical distancing. So it has really been something new to change. Some of the work that we do, even as an individual, talking to people and counseling people, just the gesture of being able to give somebody a hug. I have always known that as something that can go a long way in reassuring someone. And it feels a bit strange now that I cannot even do that because I can only be able to speak to the person from a distance. And even a smile, I mean, I would like to keep smiling and encouraging people, but if I have to keep smiling behind my mask, I'm not sure they can see this smile. So it has affected even the way I do my job. It has affected my interaction with my family. In just the last few weeks, I have missed several occasions that we had planned for a very long time. So it has in a way, turned my world a little bit to a different direction. But I must also say there are some positives as well that has come. For example, being able to think a little bit deeper into the kind of work we do because, we have to adapt to the current environment. Technology, I've had to use that much more in my work and still being able to keep in touch with the family and also colleagues at work.
Thank you so much, Dr. Ari. And Jeremy Awori, who's the Managing Director, Absa Bank. I just want to bring him in. Both Madam CS, Betty Maina, and Dr. Asha Mohammed have mentioned missing hugs. Are you also missing hugs?
I'm not able to hear.
This. Jeremy, can you hear me now?
I can hear you now.
Great. I earlier asked, I was asking you that Dr. Asha Mohammed, who's the Secretary General of Kenya Red Cross, and Madam CS, Betty Maina, say that they miss hugs and just the normal greetings. Do you miss the hugs as well? How's COVID-19 changed your life?
Yeah, I think like the other panelists have said, I think the human contact is everything. Where I'm quite social, Kenyans are social, and having to keep the distance from people is quite unusual. And I think it's quite difficult, frankly. I also enjoy, in the work context, we're a contact sport. We're interacting with colleagues, we're interacting with customers on a daily basis, and all of a sudden that has now shifted to doing it virtually, doing it on the telephone. I find it a little bit challenging being on the phone the whole day, or using Zoom or WebEx to host meetings, because you miss a lot of the non-verbal cues when you're not seeing somebody in the same room when you're communicating with them. I think the other thing for me that's been both a positive and a negative is that travel has been completely cut down. I would travel a lot with my job. And because all the airports are closed, I guess that really shuts down that, which has a positive. You can spend more time with your family, and I do that. It allows you to exercise more, and it allows you to coordinate your work to suit your schedule. So there are pros and cons to this as we adjust.
Well, many thanks, Jeremy. Everyone is just trying to adapt to this current situation, and I want to bring in Dr. Stanley Mukole from Raising Future Parents. From the other three, we have to adapt to this current situation. And Okay, Jeremy Awori also talked about, missing that human feel in meetings and just interacting using technology and also spending more time with family. So, Dr. Stanley, are these some of the things that are such a huge concern? And for you personally, how has been your experience? How has COVID-19 changed your life?
At a personal level, I am having great fun. I'm a deep thinker and I need time to think and process information. I'm having a wonderful time with my wife. At a work level, addressing future parents, we rebuild families to strengthen nations. And so the families being back home together is putting us in a place where I've always wanted families to be. So this crisis is going to strengthen families, and I'm actually thrilled by that. Not by the crisis, but by the strengthening of families.
Well, an interesting perspective there. You are enjoying this. You're having a great time because obviously building families to strengthen society, like you've said, spending more time with children at home and the spouses. Now that we are done with that part of the business, I just want to go straight into our main subject, how we are dealing with this coronavirus issue. And I want to start with the Trade and Industrialization Cabinet Secretary, Betty Minor. And the first question I want to ask you is, what is the impact of this virus on trade in the country and which sectors have been greatly affected at the moment?
Thank you. The impact of the coronavirus has been different. I think in the initial stages, the big concern was about disruption to supply chains, and especially for those who rely on imported goods from China. By the third week, the impact was more about the export side of things, with especially in Europe and America. Once the virus hit those countries and the health measures that were taken, including social distancing and closing out a lot of open spaces and markets, we saw a collapse in the market for flowers. We saw a collapse in the market for garments. Within the country, the impact, once once we had the first COVID case in Kenya and the measures were announced from the 15th of March, we've seen a lot of changes in the workplace, more teleworking and working from home, thinning workspaces, and also just the loss of some businesses. Now, the most affected sectors has been the hospitality sector. A lot of our eateries have had to close down. The second one has been our tourism. Our hotels have had to close down. The third, obviously, especially with the loss of air travel, has really affected international travel and related businesses. So we're starting to see different dimensions of impact on business. When we imposed our own measures, we've also seen an impact on cargo movement and mobility of goods, but that has been corrected. So there's been very widespread. Schools closed, so demand for local foods has also been affected once boarding schools are closed. So there's been everybody has been affected in business by this virus. Thank you.
Madam CS, still on this, many countries have come up with plans to cushion those people who've lost jobs. And in the country, like you've mentioned, out of all the sectors that have been affected, you've mentioned the hospitality industry, the tourism, air travel has been affected. And the key driving force to any economy is having, a workforce. And there are so many people who are going to lose their jobs because of the collapse of many of these industries. What is the Kenyan government doing through your ministry to cushion those people and the many who are going to either lose their jobs or rendered redundant?
I think many measures have been announced. I think the first measure that was announced was to try and increase the amount of money people had in their pockets for consumption through the reduction of VAT and through the reduction of PAYE. And that has had, obviously has an impact on people. The second thing has been the support to businesses through the measures from the banking sector, improvement of liquidity through the relaxation of the cash reserve ratios for banks. So we've taken some of those measures, but I think we continue to monitor the measures to see their impact. I think one of the things we've been quite concerned about is obviously the impact on small businesses, and that's why the support from the banks and the additional liquidity from the banks is going to help small businesses who are operational. But I think the way Corona has affected us, it has almost divided the economy in two segments. There is a component that we consider essential services that must be maintained, food and food delivery or essential delivery, cargo movement, essential services which must be maintained. But some elements have actually had to be suppressed. Hospitality and the eateries and social spaces have had to be suppressed as a part of managing the transmission level. Thankfully, these measures are seeming to have an effect for us. So at least there is a way in which we have avoided the onslaught that we saw in other countries that did not take the extreme measures that we have taken. A government has announced an enhancement of the cash transfer program for vulnerable families. The other one is also been a cash transfer for other vulnerable families and in low-income settlements and in rural areas. So taking steps to ensure that you can support the most vulnerable people is what government has done. The second thing that government has done is also turn to the domestic economy for sources of a lot of medical commodities. We have seen the increase in supplies of masks, supplies of PPEs. We're now working towards supplies of ventilators. So at least some demand has been created locally and utilization of excess capacity within our factories that have suffered depressed demand in the export markets. Then they've turned on to the domestic sources. The third thing that has been done is that as measures ease in Europe, we've seen an increasing demand for our vegetables, an increasing demand for our flowers, and now the utilization of excess capacity, for instance, in Kenya Airways to transport cargo to Europe. So that at least is at least we're trying our best to ensure that we can deliver support economy. But there's no doubt in our minds that there's still some sectors of business that are going to be hard hit by Corona, and I think and by the measures taken. But if we all comply with the measures that are
Well, I think we seem to have lost Madam CS there in our last comment there, talking about how some businesses are going to be hard hit. And when we come back from